Homecare Association, the UK's membership body for home care providers. She's in Birmingham. Jane Townson, how are staffing levels with your members?
Everybody's really struggling to recruit. Home care demand has increased substantially over the last year. In state-funded home care, possibly 10% increase in volume of hours purchased by councils. And for people paying for their own care, 20 to 30% growth in requests. So against that backdrop, we're also experiencing more staff leaving than anyone can remember and more difficulty recruiting.
Caring is clearly a rewarding job. So many of us know a carer who has held hands with a member of our family in that family member's final days. But it's also tough. It's not particularly well paid. How would you recommend it to people?
I think it's one of the few roles that enables you to really make a difference to people's lives. And quite often people do leave care, go to retail and then come back because they nowhere else do they gain that sense of really making a difference. But that isn't an excuse not to fairly recognise and reward the skill and experience that's required for these roles. These are not just about making cups of tea. People nowadays receive state-funded home care only if they've got quite advanced healthcare needs. And so our care workers are providing end-of-life care. They're supporting people that have feeding tubes, that need catheter care, stoma care, wound care. There's people with quite moderate and advanced dementias, frailty. So, they're complex roles and substantial training is needed to perform them, and we need to invest in our workforce and ensure that they feel valued. And there are huge opportunities for very interesting careers in the care sector. There are many people that started as care workers and have worked their way up even to being CEOs. So there are huge career opportunities, and it's just making sure that people can see that.
Does the shortage of staff put care home residents in any kind of risk?
So there's obviously we're providing care in people's own homes. And yes, at the moment, many of our providers have waiting lists. They haven't got the staff to meet the demand. And that's partly pent up demand following the pandemic. And it's also just the growth in numbers of older and disabled people with multiple long-term conditions, just general demographic pressures. And that means that they're having to say no to taking on new people to support, which they find really difficult because often people are phoning up in tears. Family members have reached the end of their tether. And in some cases, providers are having to hand back contracts for people that they're already supporting because they just haven't got enough staff. And the question is, who else is going to look after folk? The hospitals are nearly full, and it's not desirable anyway to neglect people in the community until a crisis point is reached. And then they end up in more expensive settings of care, either care homes or hospitals. So we really need to invest in the community, in enabling people to live well at home. And at the moment, all of the money is being poured into the NHS and very little in the front end. Only 4% of what is spent on the NHS is spent on care at home.
You talk, of course, about care at home. How important is it for someone in their final years to be able to stay at home as opposed to being cared for in a care home itself?
Well, many people choose, if at all possible, to remain in their own home, surrounded by the people that they love and connected to the communities where they've lived for many years. Sometimes people do need to move into care homes, and that's fine. But when people could be supported at home, then that's what we should be aiming for. It's the best place for them. They can eat what they like, do what they like. They can keep pets. They can basically live their lives in the way that they want. And we need to be supporting people to stay healthy at home as well. And quite often people will end up in hospital with conditions like dehydration, which clearly are preventable. And that can then lead to increased urinary tract infections, increased falls, all of which then put pressure on the NHS. So our aim should be to be like countries like Sweden, for example, where 33% of of people over 80 are supported at home. In this country, maybe only 10 or 15% are. So what we need to see is a shift in government policy, a shift in the strategy to support probably at least 15 million people are receiving some form of care at home, or they need it. But rather than just leaving them and then waiting until they end up in an acute hospital.
Jane Townson, thank you so much.
Thank you.